I'm going to go ahead and turn this over to Dr. Keith, and let's learn a little something about gut health.
All right, thank you. Well, good morning, everybody. I'm really excited to be here to share this information with you. For those of you that don't know me, my name is Dr. Keith Giaquinto, and I have a specialty in internal health. So dealing with things like immune issues, digestion problems, hormone imbalances, allergy issues, skin issues, all that stuff is what I deal with in my practice from a natural perspective. So going through today, we're going to be talking specifically about depression, anxiety, and the gut health link. So hopefully there'll be some great information here for you guys that you can take away and start implementing in your life immediately. So let me share my screen here. All right, can everybody see that? And still hear me? Okay, great. Okay. So if any of you guys have any questions during any of this, feel free to speak up and just stop me, because I want this to be more of a dialogue if you've got questions, and there's no such thing as a stupid question. So feel free to interrupt me anytime. If you guys want to get connected with me, I'm on Facebook and Instagram under Giaquinto Chiropractic. I also have a YouTube channel where I have other lectures up on there under Dr. Keith Giaquinto. I have one on digestion disorders, allergies, and asthma, and another lecture on food intolerances and sensitivity, where I go talking about dairy and gluten and GMO foods and all that stuff. So if you really like this video or this lecture, you can get more of me on social media and on YouTube. So let's start talking about today. What we're going to be talking and going through today, in today's agenda, is to shift the mindset of our community from that more of a disease care model to more of a wellness model. And what I mean by that is that the disease care model is one that's more reactionary. We wait for a crisis to happen before we do anything about it. So we kind of have health as a default, and switch it more to more of a proactive model where we're more conscious, we're more educated, we're creating healthier habits in our lives so that we can prevent things from actually happening to us. The second thing is I'm hoping to inspire you to change some things in your lifestyle that could lead you to a longer and healthier life. And then ultimately, for those of you that have people that are suffering with anxiety or depression, is to hopefully empower you to share this information with the people that you know and care about, family members, friends, neighbors, co-workers, so that they can actually benefit from this information as well. So before we get into anxiety and depression and the gut health link, let's kind of identify what is health. What does it mean to be healthy? And looking at it from a definition perspective, I really like this definition that comes from the World Health Organization, and they made this definition back in 1948, and it still rings true to this very day. And what they say is that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmary. And I really like this definition because us as human beings, we are not just our physical body. There is a mental or emotional component to us. There is a social component to us. There is a spiritual component to us. There is a nutritional or physiological component to us. All these types of things go into our body's ability to express health. And that's what the body was designed to do, to easily express health. But in our community here and our culture, we have been dangerously misled that we are a symptom-based society, meaning that if you have symptoms, you are sick or have a disease process. And if you have zero symptoms, that you are completely healthy and fine. And nothing could be further from the truth. There is a big gap between not having symptoms and having a robust health in your body and your body's ability to function. So it's kind of like a healthy body plus a healthy mind equals a happy and healthy human. So how do we get sick? Well, it starts with function. We are functioning at 100%. And when our body decreases in function, it gets to a point where it has to give us a signal or a symptom in order to tell us that we're not functioning properly. And how does our body decrease in function? Well, this is where stress comes into play. When stress wears our body down, the function of our body decreases, and it decreases to a point that it reaches a threshold. And then we become symptomatic. So then we might do something to help increase the function of our body, where we might go to bed an hour earlier and get some extra sleep. We might drink some more water. We might do something that nurtures that inner child, that brings, energy back into us and put down the stresses of life for a while. So then we might get above that threshold and become asymptomatic. Now, most people hover across this threshold most of their life. But as you can see, you're not functioning at 100%. You may be functioning at 50, 60, maybe 70%. And when that happens, this is the perfect environment for your body to set up and foster or create a chronic degenerative disease. Cancer and heart disease are the top two killers in this country. Both of them are preventable, according to the CDC. So when we are having an ongoing process or degenerative process in our body, we may not feel it at first. You may go into your doctor's office for your annual blood checkup. They'll run your blood pressure. Your blood pressure is a little on the high side, or it's getting higher and higher, right? You might run some blood work. You might have some liver enzymes that are off, or an increased inflammatory rate in your body, but you may not feel any different. You never feel the degeneration that is occurring in your body until enough damage has already been done, right? When people get osteoporosis, right, they don't feel the beginning of their bones becoming brittle. So health has nothing to do with how we feel, and it has everything to do with how our body is functioning. So how do we get the body back up to peak performance and as close to 100% as possible? Well, this is where healthy habits have to come into play. And we create those habits and we work on those on a daily basis. So when we're talking about health, the one thing that I love about my job is that the human body is innately intelligent. And every single cell inside our body has an innate intelligence. Now, what do I mean by innate intelligence? How do you get, when a sperm and an egg comes together and they fuse together and make one cell, how does that one cell then turn into 40 trillion cells without conscious thought? When we get a scrape on our arm or a burn, right? How do we, that redness and the bleeding, and then it scabs over and then it heals. Like, how does that happen without conscious thought? This is the work of innate intelligence. Every single cell in your entire body is programmed for well-being. It is programmed to grow, repair, and to maintain homeostasis, or the internal environment. So what I really want you to understand is that health or well-being is our natural state. Because the power that made the body is the exact same power that heals the body. Health happens no other way. Health is always, always, always an inside job. So when you have a strong and balanced body, it can very easily express health. So when we're talking about the ability to heal or health, there's an equation that I like to work with here. And this is where 100% function, which is variable, which is what we just talked about, plus the innate intelligence, which is always a constant. So innate intelligence and homeostasis is always on the job. It always gets the job right every single time. The question is, does our diet and lifestyle support one of health so that our body can easily express it? Or do we abuse our body to a point that it breaks down, it decreases in function and gives us symptoms as a result of that. So again, how does the body decrease in function? This is where stress comes into play. And when I'm talking about stress, there's 3 forms of stress that I'm talking about. Number 1, we're talking about mechanical stress. Number 2, emotional stress. And then number 3, we're talking about nutritional stress. So let's just look at that for a moment. Mechanical, emotional, nutritional. M-E-N, men. Men make us sick. So when we're talking about mechanical stress, what are we talking about? Well, we're talking about subluxations and poor posture. So what a subluxation is what chiropractors treat is where your spine becomes misaligned because the joint is restricted or you've got muscle contraction in your spine that is inhibiting nerve interference so that your brain cannot communicate to your body and your body cannot communicate to your brain. This is going to decrease the function of your nervous system and the overall expression of health in your body. When you have poor posture can create subluxations. So when we're talking about emotional health, we're talking about the mindset component, which we're going to be talking about in a moment. But then we're also talking about relationship issues. And then nutritional stress, we're talking about diet, which is what is on the end of our fork, but also our body's ability to digest and absorb the nutrition from the food that we eat. Just because we stick something in our mouth and we swallow it does not mean that it is 100% digested. It does not mean it is 100% absorbed and utilized by your cells and your organs in your body. I have so many people that come to me that have a very clean diet, that exercise regularly, but yet they still have all these health issues. So it's not a question of their diet and exercise that's the problem. It's a question of their ability to digest and absorb it and the subluxations that we find in their body. So then a poor diet and weak digestion can lead to blood sugar issues. And then when we have nutritional imbalances in the body, it can lead to other organ dysfunction. So it doesn't matter to your brain or your body what form of stress it is under, mechanical, emotional, or nutritional. Your body combats all 3 forms of stress one way and one way only. How does it do that? It requires more nutrition. This is the only way that our body can combat stress. And when we rack up this nutritional deficit and this deficit grows and it grows and it grows, how does your body compensate for that nutritional deficit? It causes muscle contraction. Do you ever have that tightness in your back, whether it's your low back or your mid back or right there at the base of your skull that just seems to be always tight, regardless of how much you stretch it or strengthen it? This could be because of a subluxation, or it can be because of a nutritional imbalance in the body. So when a body is weak and unbalanced, it can very easily express dis-ease. And when I'm talking about dis-ease, if you look at the word, dis-ease is basically a synonym for the word imbalance. Your body is out of balance. So when we're talking about stress, we're talking about that triad, mechanical, emotional, nutritional. And these are very interchangeable. So let's just kind of give you an example of what we're talking about here of how a primary stress of a mechanical issue, whether it could be subluxations, poor posture, or a combination of both, or even an injury, right? You bend over to pick something up and you tweak your back, or you get an extra hard workout in at the gym and you tweak your neck or your shoulder, right? There's some sort of mechanical issue that's going on. This can create emotional issues, which can then create more nutritional imbalances. Because with that mechanical and emotional stress there, your body is requiring more nutrition to combat that. It can happen the other way, right? If you have an argument with somebody, or you're holding a grudge, or whatever it may be, the emotional component can be the primary source. And then your body is going to require more nutrients to combat that. And if you add in a poor diet and weak digestion, this is going to lead to muscle contraction in your spine and subluxations. Or it can start nutritionally. You can have a poor diet that then can cause muscle contraction, which then can cause emotional issues. So it's a triad that is interchangeable, and it really, when we're talking about healing, you have to take all three of these into consideration, because it is a domino effect that occurs. One thing happens first, and then it trips something else, and then something else trips, and it's this vicious cycle that starts to occur. And then we get stuck there, and we don't know how to get out. So addressing all three of these is really important in order for the body to heal. So when it comes to anxiety and depression, we're really looking at the emotional component being one of the primary causes, which then can cause nutritional issues and then leads to subluxations, or it can be coming from a poor diet. A lot of times when I see people, my patients that come in that have anxiety and depression issues, their diet is terrible. They eat nothing but refined carbohydrates, sugar, and genetically modified and processed foods. And they wonder why they're sick. The nutritional imbalances from the poor diet then can lead to emotional issues, which can then lead to subluxations in your spine. So the mechanical aspect of it is just that fuse, right? You get overwhelmed, you have nutritional deficits, and you blow a fuse. That fuse is subluxations in your spine. So having chiropractic care with this can help reset the circuit breaker, reconnect the communication between your brain and your body, and allow the healing process to begin. We're talking about anxiety, and the definition of it is a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. So basically it's kind of something that is about to happen that we're stressing and worrying about. This could be a deadline, this could be a tough conversation you got to have with somebody, whatever it is, there's so many things to be anxious about. Depression is an emotional state that is marked by feelings of low self-worth, guilt, and a reduced ability to enjoy life. So when people are anxious or depressed, what is their health like? Are these people ones that have robust health? Or are these people that are kind of sick all the time and always have stuff going on and fatigued and exhausted and just seem to be very overwhelmed and scattered? Yeah, it's more of the latter. So I used to become very well versed in becoming anxious. When I got out of school, I moved out to Santa Monica, California, and I bought a clinic that was out there. And now that have my own clinic, I'm like, great, what do I do now? I don't know anything about how to run a business. In chiropractic school, they just taught me how to become the doctor. I don't know anything about business or marketing or bookkeeping. So for the first 3 years, I was a master at being anxious. I would literally go home at the end of the day and I would eat my dinner and I would pass out from mental exhaustion just because the learning curve was so huge. And then I came across this book, The Power of Now. I don't know if you guys have ever heard of this, but this book changed my life. And I read this book, I became a student of this book, and I mastered how to become 100% present all through the day. And when I was able to do that, I was simply amazed at how much energy I had at the end of the day. So in this book on page 61, Eckhart Tolle, he says that unease, anxiety, tension, stress, worry, all forms of fear are caused by too much future and not enough presence. Guilt, regret, resentment, grievances, sadness, bitterness, and all forms of non-forgiveness are caused by too much past and not enough presence. So when I really understood this, I'm like, this is so true. So let me give you an example of how it could reflect in your own life. So let's say that your brain has, for simplicity's sake, has 100 units of energy to get throughout the day. So you get up out of bed and you go and get in your shower. Now you're still kind of holding a grudge from, your boss chewing you out from yesterday or earlier in the week. So you're kind of holding on to that. And you're kind of start thinking about that. So boom, there goes 20 units of energy right there. And then you're worried about the deadline that's coming up or the pressure of a project that you're doing. Boom, there's another 20 units of energy gone right there. You're still in the shower, but you are thinking about these things and you're not being present. Because our brain is a glucose hog. It loves glucose and it burns that so quickly when we are not being present. So now you get out of the shower, you're down 40 units of energy, you got 60 units of energy to get through the rest of your day and you haven't even left your house. This is what being not present can do to our bodies, the amount of nutritional imbalances that it can occur simply by not being present through most of the day. So there are some certain mindsets that we can kind of get trapped into being a human being, all right? Being present or not being present is one of them. But I want you guys to understand too that all stress is self-induced. We create our own stress. Everything in this world is completely neutral. Once we take things in and we process it, we get to choose what we give power to. We can paint it either as this person's right, that person's wrong. We can create a judgment. This person is the hero, I'm the victim. So everything in life is completely neutral. And it's once we take it in and process it, we choose what to give power to. So there are certain things as humans that we can obsess about that can cause this mental fatigue. Our constant obsession with the future is one of those. Constant comparison to others, a constant judgment of others, or being critical of ourselves. Having self-doubt, low self-esteem, or being insecure. All of these things can really drain us of our mental energy and cause physical manifestations of health issues. So let's kind of dive into this a little bit. I kind of talked about not being present, but what can we do for that? Well, we can practice present time consciousness. Whenever you feel like your mind is wandering or you're starting to feel anxious or a little bit depressed or whatever's going on, the one thing you can do instantaneously to bring you back to the present moment is simply breathe. Stop whatever you're doing, sit down, empty your mind, take a nice deep breath in. Feel the air go in, feel your lungs expand, feel your lungs contract as you're exhaling. Take several deep breaths and this will bring you back to the present moment. Something else that you can do is use your senses. Do you smell anything in the air? If you're outside taking a walk, do you smell any fragrance of a flower or something? Do you smell anything in the room? What do you see? Can you hear anything? Can you hear the rustle of the traffic in the background? Can you hear footsteps upstairs or downstairs? What can you hear? Can you hear birds out in the yard? And touch. If you're sitting in a seat, can you feel the seat underneath you? If you're standing, can you feel the ground under you? There's all types of things like this that you can do to bring your mind back to the present time. Where is your energy? Where is your focus? When people are anxious or depressed, it's usually because their focus or their energy is outside themselves. They're more concerned about what so-and-so thinks. They're more concerned about that deadline and the anxiety of that. We need to take our power back in order for us to heal. So when people are experiencing anxiety or depression, that anxiety or that their focal point is outside themselves. So what can you do to help control your mind and your thoughts? Well, this is where meditation comes into play. And learning how to meditate can be very challenging for people, but when you master this, it is such a great gift. And there are so many health benefits of learning how to meditate. Because look at it this way, your mind is a muscle. And just like your physical body, if you don't physically exercise your mind, it's going to atrophy and run wild and cause problems as well. I mean, the average human has anywhere between 50 to 70,000 thoughts in any given day. And Eckhart Tolle, in his book, The Power of Now, he also says that if people don't have control over their minds, that's just as much a disease as somebody who has cancer or heart disease or diabetes or any of those chronic diseases. Because it's so true. What our mind says consciously or subconsciously, our body has to react to. So learning how to meditate to a point where you can control your mind and your thoughts is very, very beneficial. So even if you just start with like 10 minutes a day, it can be very helpful for you in learning how to control your thoughts. What else can you?
Dr. G?
Yes.
I got a quick question for you related to that. I think this is a really good reminder of the importance of practicing consciousness. Are there some techniques that you could recommend that to help people really center in that? Like whether it start with your head, your feet, like what? And I know you had talked about like getting a sense of what's around you, but what are some ways that we can really be grounded in that moment of being present?
Yes, that is a great question. And look at my next bullet point. Love you, Tish. Yes, great question. And exactly, because you can have that moment of being regrounded, but then your mind wanders and that quietness can go as quickly as it comes. So there's other things that you can do to really like dwell in that and sustain that present time consciousness. This is where doing things like Tai Chi and Qigong and yoga can really kind of come into play because you're doing it for longer periods of time. When I was out in California, I took 2 medical Qigong classes, and I started doing 20 minutes of Qigong in the morning. That was part of my morning routine. And I'll tell you right now, just practicing 20 minutes of that, it really helped keep me grounded for the entire day. When I didn't do that, I felt like I was very scattered and I was less productive throughout the day. Because we are also energetic beings. And Tai Chi and Qigong and yoga, all 3 of those use your body with certain forms. It's using your breath, and it's using your mind and your ability to be present in order to get anything out of that practice. So doing things like that and learning some of those things, as well as meditating, can help to sustain that. But it kind of comes back to just, you ever go shopping for a car and you're like, I don't know what I want to get. And you start researching something and all of a sudden you fixate on this one car. And now everywhere you go, you see that car. It's everywhere. So the same thing kind of happened with your mind, right? We can observe our thoughts and we can actually choose what we give power to. Are we present or are we not? And the more that we focus on being present and getting that book, The Power of Now, and reading that and becoming a student, like it takes time and it takes practice, just like anything else. But the more you do it and the more you are aware of being 100% present throughout the day, the better you're going to get at it. It's a skill just like anything else. So does that answer your question, Tish?
Yes, thank you.
Yes, awesome.
I was going to add to that if I could for a second. One of the things that I learned years ago, actually in California, from a friend of mine this was 15 years ago, who was heavy into yoga, and she was always like, you need to do this. It's so good for your body. Whenever I was stressed, I would lay down and she would tell me to think about my toes, down to my feet, up through my calves, and just relax your entire body in sections. And it was amazing because now if I get stressed or anxious and I'm able to lay down somewhere, It's one of the things that I do that help me really calm and like center. So it's a nice way to, if you're not doing yoga yet or anything like that, it's a nice way to, you know, just regain your consciousness and presence.
Yes, exactly. There's so much that you can do. I mean, there's so many different ways to meditate. Like you can do a walking meditation. Like if you have a dog and you're going for a walk, focus on being 100% present. Feel the ground underneath every single step that you're taking, and don't focus on anything else. Meditating, you can light a candle and just sit there and stare at the flame and try to not think about anything, right? Staring at a flower, right? There's all different types of things that you can do to relax the body. We don't understand how powerful our mind really is when it comes to our physical health, and really learning and to take control of that. And thank you for saying that, Lori, because is great. There's so many, it's so creative. There's so many things that you can do to practice getting back into your body. So awesome. Any other questions about that or comments? Okay, let's move on. All right, so obsession with the future. Us as human beings, we think things are a competition. We think there's a destination, there's an end point, and we have this attachment to the outcome. So it's kind of like, all right, once we get there, then I'll be happy. Or once we get there, this will happen, blah, 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 blah. So instead of thinking of it in those types of terms and being attached to an outcome, we need to switch our perspective and shift it to that one of a journey, and that we are a co-creator. So when you're thinking about having that destination and endpoint, you know, I don't know if you guys have seen this movie or this book is called A Peaceful Warrior, where, you know, this guy, Dan Millman, was an athlete in Berkeley, California, and his whole goal was, he was a gymnast in rings and stuff. And his whole goal was that he wanted to qualify for the Olympics and bring home the gold medal. And he's like, once I get there, then I'll be happy. And Nick Nolte was in that movie as kind of like the old sage who's trying to teach him to shift his perspective on that. And that, well, if you're not happy now and if you're not present, then what says you're going to be happy once you get the gold medal? Who says you're even going to get a gold medal? So it's all about learning how to enjoy the journey and learn how to become, co-create what it is that you really want. Another thing that I saw is that this book that I got, it's called The War of Art, on page 88. They say in there that we only have the rights to our labor, not to the fruits of our labor, which kind of brings us to that same point, right? We are so attached to a certain outcome or a certain expectation that it kind of ruins the whole journey. But if we can come completely detached from that and just enjoy the process, we'll be a lot happier as a result of that. And surrender to the process. And surrendering may not be a one-time event. It may be something that you might have to do again and again and again and again. So it may not be a one-time process. When I first moved here to Naperville in 2013, I was 11 years in practice already, and I knew one person in Naperville. So I'm launching a brand new practice in a community that nobody knows who I am. You want to talk about trusting the process and surrendering to it, man, it was tough in the beginning. But, you know, I put in the sweat equity. I went out and I literally knocked on over 900 doors of businesses and residents, just introducing myself to people. I jumped into the Chamber of Commerce and started volunteering and going to ribbon cuttings, jumped into the JCs and started doing lectures in the community to build up my name. So surrendering to the process, but at the same time, we have to take action in the direction of what we want to go. Because I tell this to my daughter all the time, we only have control over three things: what we think, what we say, and what we do. And that's it. How people react or respond to you is completely up to them. But if you can stand in your power and speak your truth, that's the best that you can do. Our constant comparison to others. Well, with social media going on and everybody putting on their best face on social media, it's very easy to see that if your lifestyle doesn't match others, that you can very easily become depressed. So stop comparing yourself to others, because the only person you should be in comparison with or competition with is yourself. Us as human beings, we were put on this earth to continually grow, evolve, and expand. So are you a little bit better today than what you were yesterday, last week, last month, last year? That is the only thing that you can really compare yourself to, is just becoming a better human being as we're going on this journey called life. So there's something else I'm going to say about that, but I forget. Anyway, okay. So then judgment of others and ourselves, low self-esteem, and being insecure. Well, the first thing is let go of needing the approval of people from outside you, right? One of the things he was talking about in The Peaceful Warrior, again, I'm going to refer back to that, was he mentioned something to the guy that's playing Dan Millman. He's like, you know, you need to stop listening to the voices outside yourself and start listening to the voices inside yourself and stay true to who you are. So letting go of that need for outside approval. Just live your life. The other thing with low self-esteem or being insecure, people that are depressed, is that they don't have a vision. They don't have a goal. They're not heading towards anything. They're just idling by and letting life dictate them. So have a vision of what you want. Set a goal. The more clear you can become, the better off it's going to be. But then the best way to get some confidence is to take action. Stop thinking, and just act. Go do. It's the safest thing and the fastest way to get out of that depression is by taking action. And then ultimately being kind to ourselves, right? We can be our worst critics sometimes. So letting go of those expectations, just being kind to yourself. Because, you know, Frank said it best, confidence is king. So live your life with confidence. Know what you want and go after it. Action is the road to self-confidence. Take one small action and let the action lead to confidence, and let the confidence create energy towards more action. And from the snow melt, a surging river will form. One of the amazing guys who said this was Bruce Lee. Love me some Bruce Lee. I do some martial arts as well, and you know, this guy was not only a perfect physical specimen, but he was such an intellect and a philosopher as well. Because really what it comes down to is being comfortable in your own skin, learning how to speak your truth and live your life with confidence. Because he also said that honestly, expressing yourself, it is easy, it is very difficult to do. I mean, it is easy for me to put on a show, be cocky, be flooded with a cocky feeling, or I can make all kinds of phony things, blinded by it, or I can show you some really fancy movement. But to express oneself honestly, not lying to oneself, now that, my friend, is very hard to do. And in one of my books that I have about Bruce Lee, there's a story that really kind of shifts your perspective of this whole thing I'm trying to talk about here. Is that Bruce Lee went out to lunch with his attorney, one of his attorneys, at this upscale restaurant. And they go and they get seated, and this waiter comes over to take their order and recognizes who Bruce is. And the waiter proceeds to be extremely rude to Bruce. Now, he took his order and stuff, and Bruce just smiled and completely ignored his rudeness. And when the waiter left, the attorney turned to him and said, "Hey, are you going to take that from him? Like, you're Bruce Lee, you could squash him." And his response completely shocked me. And what he said was, "Well, I came in this restaurant in a good mood. Why would I choose to let him take me out of it?" And that just blew my mind and just blew me away. And it just kind of goes to show and summarizes kind of what we're talking about here. So to kind of review everything, we're talking specifically about the mindset. Become a student of you. Understand what makes you tick. Journaling can come into this as well. Gain control of your thoughts. Learn how to become 100% present. Meditate. Do Qigong, Tai Chi, yoga, whatever it is. Have a vision, create a goal, have some clarity, and take action. But fall in love with the process. You know, I have a chiropractic coach that talks to me and about some practice management stuff. And, you know, there's some mundane things that I can do in a practice, you know, like doing re-exams, little things like that, billing, blah, 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 blah. And he's like, you need to fall in love with that. Yes, it might be boring and tedious and mundane, but you need to fall in love with it. So fall in love with the process of just enjoying the journey. Surrender to it again and again and come from a place of strength and confidence. This will change your life. All right, any questions up to this point before we shift to the gut?
I just want to share a book with you all that's really amazing. It says it's a workbook guide for women, but everybody could use it. This is Mindful Makeover. It's really ironic. I didn't even know what we were talking about today, but this is like a journaling. You can actually get this either on Amazon or there's a store in Naperville that I went to and saw it in there as well. This is a friend of mine, and it is awesome. So Mindful Makeover. It just kind of helps you like plan and kind of create the life that you want and think about certain things in a different light. So I've really enjoyed it. I'm only halfway through it.
Excellent.
Well, I should be done, but it's really good.
Yeah. Thanks for sharing. Yeah, that's awesome. Well, look, life is messy, you know? We get distracted. We get pulled in so many directions. So it really is kind of hard to maintain that focus sometimes. And sometimes you just gotta throw your hands up and just laugh. So awesome. Thanks for sharing that. Anything else before we go on?
I was wondering if you could just speak to the balance between setting a goal and living in the moment, because the goal is future, right?
Correct. So
there's a disconnect if you don't have your goals. So there's a tension.
Yes.
But you're supposed to live in the moment, right?
Yes, correct. So great question. So you can strategize and think about stuff that you want to do in the future, but you don't want to live there or obsess about it. That's where it becomes a problem. So you can like sit down and take like an hour or so if you want. And I mean, part of me being a small business owner and owning my own practice is being the doctor is one part of it, and it's the easy part. But it's being the business owner, the accountant, the bookkeeper, the marketer, you know, the billing expert, like all that stuff comes into that. So when you're sitting down to strategize or to set a goal or to coordinate or make up an event, you can do that, and you're thinking about it in the future, but you're also in the present moment. It's not like, I mean, when you're with somebody, like you can tell when somebody is very scattered and they're not present when you're having a conversation with them. That's where it becomes excessive. So I don't know if that kind of answers your question there, Jen, but that's kind of what I got for that. Make sense?
Thanks. Yep. Thank you.
Yeah. All right, moving on. We're going to switch gears. Here comes gut health. All right. So, anxiety, depression, and gut health. There is this gut-brain axis that we're going to be talking about briefly. We're going to talk about blood sugar problems, and then we're going to talk about the microbiome imbalance. So what causes blood sugar problems and the microbiome imbalance? This is where we get stress, a poor diet, weak digestion, which leads to leaky gut and chronic inflammation, and then adrenal exhaustion. And our adrenal glands are little walnut-sized glands that sit on top of our kidneys. These are one of the very first lines of defense in the body against stress. So when we have chronic stress, we can burn out our adrenals, and this is tied directly to blood sugar problems. So we're talking about blood sugar, right? Blood sugar goes up, blood sugar goes down, depending on what we're eating. Because if you just had a soda, a Coke, you're going to get a blood sugar spike and an insulin spike. So it's going to go up. Versus eating some vegetables or a piece of fruit, you're going to get maybe a mild to moderate blood sugar spike. So it's going to swing throughout the day. But what we want to do and hope to do is to keep it on this tight rope. Because at the top, the bottom end of it, you know, we got like 60 points, at the top end, maybe 120. But for every individual, your own body has its a set of parameters in which your blood sugar swings. Some people it may swing 10 points when you're on an empty stomach compared to what you eat. It may swing 20 points. It may go more depending on what you're actually eating. So if your blood sugar goes low way too fast, this is what's called hypoglycemia. If your blood sugar goes up way too fast and your body can't handle it, this is where you get hyperglycemia, which basically just means low or high blood glucose in the blood. And what research shows is that when we have hyperglycemia, what is characterized by hyperglycemia? Well, we get to be anxious, restless, nervous energy, irritable, and moody. When we become hypoglycemic, what is that characterized as? Depression, fatigue, lethargy, or forgetfulness. So this is what happens when we have blood sugar swings and where this irritability can come from. Because I don't know about you guys, but have you ever noticed when your blood sugar drops, what happens? You become very hangry, angry and hungry at the same time. And when my blood sugar drops, what I notice is like, I can't make a decision anymore. Like I can't think, don't talk to me, get me food now, right? So I'm sure some of you guys can relate to that, but that's what it's like when you have a hypoglycemic or hyperglycemia. You can experience these different symptoms. So what controls?
Can I add a story?
Yes, go ahead, John.
10 years ago, I was getting seriously depressed, having no idea it was my diet. My kids got so concerned, they sent me to a doctor. He never asked me about my diet. He put me on antidepressants, which didn't work. They gave me nightmares. Somebody got cancer. I didn't want to get cancer. I hired a nutritionist so I wouldn't get cancer. All of a sudden, she has me off sugar. It changed my whole life. I was overweight. I was getting depressed all the time, and I got off sugar. It's like within 6 weeks, I was a different person.
That's awesome. Love that.
Just from diet. Changed my diet. John, just walk a mile a day. I started walking. I used to weigh 200 pounds. I now weigh 175.
That's awesome. Great job. Yeah, and and John, what does sugar do in the body?
Oh my God!
What does it cause?
You just explained it.
Yeah.
Whether it's going way up or way down. When it went way down, I was depressed as heck, and it was awful.
Yeah. So the answer I was looking for was when we eat too much sugar, it causes inflammation in the body, and I'll show you in a little bit how that's tied to depression. But yes, I mean, having a cookie is one thing. Having a half a dozen or a dozen of them, like that's excessive, right? So it's when you look at your diet and you're eating simple or processed carbs at every single meal, right? It's trying to get to more of the whole grains and things like that and your fruits and your vegetables. So thanks for sharing, John. That was awesome. Well, it just goes to show you the ability of the body to heal when you find the right thing.
It was overnight.
Yeah, that's awesome. Love that.
Yeah, thank you.
So what controls blood sugar? Well, it starts with stress management, diet, digestion, and then your adrenal glands. So when we have chronic stress, your adrenal glands secrete cortisol, which is the stress hormone. And the main function of cortisol is to increase blood glucose. So when you are chronically stressed, you are going to have high blood glucose all day long. When we have a diet that is excessive in sugar and caffeine and GMO foods and processed foods, this is going to cause inflammation in the body and also stress out the adrenal glands. We can have weak digestion and then adrenal exhaustion. So what are some symptoms of weak digestion? Well, this is where you can experience heartburn or reflux, bloating, gas, constipation, or diarrhea. Adrenal exhaustion, how do you know your adrenals are exhausted? Well, this is where you have sleep problem, especially waking up in the middle of the night and you can't get back to sleep. You sit there and you toss and turn for an hour or two. You just are fatigued throughout the whole day. Like or even in the afternoon, like later in the afternoon or after lunch, you just have this fatigue that sets in. Mood swings, you crave sweet or salty things. You have an overuse of caffeine or stimulants, and you have a weakened immunity. So an adrenal exhaustion can cause weak immunity due to stress. So we're talking about the gut-brain axis. This is a bidirectional link between the central nervous system and the enteric nervous system. So I'm not sure if you guys are aware of this or not, but our gastrointestinal tract from our mouth down to our rectum is one big hollow tube. And in that hollow tube are layers of muscle, but the gastrointestinal tract has its own nervous system that runs independently of the brain. But it communicates to the brain through the vagus nerve and other things. So this is what we're talking about with the gut-brain axis and the neurological component. So the gut-brain axis involves direct and indirect pathways between cognitive and emotional centers in the brain with intestinal functions. It involves complex crosstalk between the endocrine or hormonal system through the hypothalamic pituitary adrenal axis, which is responsible for stress and hormonal balance in the body, your immune system, which is where inflammation comes from, and the autonomic nervous system, which is your subconscious nervous system, which is your sympathetics and your parasympathetic nervous system. So where is 70% of our immune system is located in our gut. So when we have chronic stress, a poor diet, and weak digestion, it can cause leaky gut issues and chronic inflammation. So there is this paper, this research review paper that I found that goes over several different things. And this is to your point, John, of exactly what you were talking about. Recent studies have revealed that inflammation, among other factors, may be involved in the pathogenesis of depression. One line of studies has shown that depression is frequently associated with the manifest gastrointestinal inflammations and autoimmune diseases, as well as cardiovascular disease, neurodegenerative disease, type 2 diabetes, and also cancer, in which chronic low-grade inflammation is a significant contributing factor. Thus, depression may be a neuropsychiatric manifestation of a chronic inflammatory syndrome. And this speaks to exactly what you were talking about, John. This was the mechanism in why changing your diet and getting outside and walking helped. That's awesome. Same paper talks about another line of study that shows the primary cause of inflammation may be the dysfunction of the gut-brain axis. Lifestyle factors may primarily affect the symbiosis between the host mucous membrane and the microbiome. Local inflammation may also influence the function of the brain and other organs. Role of metabolic bursts due to inflammation represents a new aspect in both pathophysiology and the treatment of depression. So this was huge. And a lot of times when my patients come in, this is the stuff that we work on. So what causes inflammation? Well, chronic stress, poor diet, weak digestion, and adrenal exhaustion. Do you guys see a theme recurring here? I'm hoping to hit this point home for you guys. So let's talk about the microbiome. What is the microbiome? Well, there's approximately 10 to the 14th power microorganisms, which is around 10-fold more than cells that are in the human body. So there are way many more microorganisms, to the count of 10-fold or more, of microorganisms in our gut than human cells in the entire body. So the microbiome is such an important part of our overall health, and you really have to look at it like an additional organ. What would happen if you didn't have a liver, or if you didn't have your lungs, or a kidney, right, or a bladder? All of the homeostasis in the internal environment relies on all of these organ systems to work in harmony in order for the body to express health. So the microbiome is no different. Disruptions to the microbiome are increasingly becoming associated with the prevalence of allergies, autoimmune diseases, metabolic disorders, and neuropsychiatric disorders that affect today's society. There's one study, this neuropharmacologist and microbiome expert at the University College Cork, Dr. Cryan, he showed that the gut bacteria can alter brain chemistry. He found that after eliminating good bacteria in mice, that they act in ways that mimic human anxiety, depression, and autism. In one of his studies, 2 strains of bacteria were more effective than an antidepressant at treating anxiety and depression. So it's pretty powerful stuff. So how do we disrupt our microbiome? Well, chronic stress, a poor diet, weak digestion, and then antibiotic use. This is why when people take antibiotics, it can disrupt their gut. They can start to get diarrhea or even constipate them, because antibiotics destroy the good bacteria as well as the bad bacteria. And we need the good bacteria to be there in order to do what they need to do for the body. There's so many beneficial things that the microbiome does. So balancing out our microbiome. Well, we have to manage the stress. This is the most important thing. Eating lots of fruits and vegetables and fermented foods can really help to kind of balance out that microbiome. Strengthening digestion, right? Getting a chiropractic adjustment can help strengthen digestion, taking digestive enzymes. And here's one that you might not think of, is chewing your food, right? In today's society, time is our biggest commodity, and we simply don't make the time to sit and eat. So many of my patients, when they come in and they have health issues or digestion issues or whatever is going on, I always emphasize chewing your food. When you sit down and eat, sit down and eat. Chew your food and chew each bite until it's almost like a liquid soup before you swallow it. Your stomach does not have teeth. So if you don't chew your food in your mouth and you take 3 bites and you swallow your food whole, is that really nourishing your body? No, it's not. It's causing problems. Eliminate any infections. So the microbiome in the small intestine, we have to think of it like a garden, right? When you have an imbalance, or you take a round of antibiotics after a round of antibiotics and you wipe everything out, and your diet is nothing but sugar and processed and GMO foods, you can never reestablish your microbiome or the balance. So then you got these bugs that are just growing down there. And they could grow for months, years, even decades, and cause all kinds of issues that you don't even know about that's there. So sometimes you have to eliminate infections first before you can reestablish the good guys. And then taking probiotics. But I want you to understand that simply by taking probiotics, it may not solve the problem at all, because there's a domino effect that occurs. It begins in your mouth and what's on the end of your fork. And right now, I want you guys to know that every single one of you has 100% control over what's on the end of your fork. You have 100% control over being able to chew your food. And both of these things occur in your mouth. Then it goes to the stomach and it causes, you have to digest that. So if you've got subluxations in your spine, or you are stressed out, or you have enzyme deficiencies that you cannot break down your food small enough, or you swallowed your food whole, you're going to have weak digestion. This leads to the small intestine and the microbiome. So you can see simply by taking a probiotic may not do you any good. And none of this will do any of you good if you don't get rid of or minimize the stress. Now, I want you to understand, it's not about completely eliminating it, because sometimes it's hard. Life is life and shit happens, you know, but can you manage it better? Can you put the stress down for a little bit to give your body the time and the space for it to actually heal? So that's what, yes.
Quick question. So your second point about stomach digestion and taking the time to chew your food adequately. If you've had bad habits and you didn't really take the time to chew your food adequately, how long does it take to reverse the effect that that bad habit has on the digestive system? Do you know what I mean? Like when you make a decision to try to do the right thing, how long does it take to reverse the bad habit?
Are you talking about chewing just for one meal that you're eating, like you're in a hurry and you know you didn't chew your food and you're feeling bloated and disgusting? Because
no,
that's happened to me, you know?
That's part of it, but like overall, you have this systematic bad habit of not chewing your food and kind of just inhaling it, and now you want to make a different choice.
Sure.
How long does it take to reverse that effect?
I would say, you know, for every new habit, give yourself a month to work on it.
Mm-hmm.
Because we don't change overnight. And for whatever reason, chewing your food can be like the easiest thing for people. Or I have patients that come in, they're like, you know, I can't chew my food. Like, I just can't, because it's so ingrained in them, like they're not present when they eat. So anything that I'm talking about here today, like learning how to meditate or getting out for a walk or whatever, give yourself 3 to 4 weeks to create that new habit.
And then how quickly would we be able to see that the change, once that is our new habit, how quickly will we be able to see that impact on our digestive system?
Well, I mean, if chewing your food was the only thing that was the missing link, then you should feel immediate relief or results from that. But if you have other digestion issues or enzyme deficiencies, or you can't concentrate hydrochloric acid enough in your stomach, or you've got subluxation, there are other missing factors into that if you're not experiencing any relief, is what I'm saying. So you might have to look outside the box. It's not a end-all cure-all for digestion issues, but it helps to strengthen it. Let's just put it that way.
Okay.
Just to add to that really quick too, 2 years ago I cut out dairy because I was having so many issues. I mean, I was walking around looking like I was 9 months pregnant all the time.
Mm-hmm.
Couldn't figure out what it was. I cut it out, changed my life completely. And then I've been the last year plant-based. I'm working on it all the time because it's hard. But it's really the way I feel and things that are cut out of my life now, like illnesses and different things, night and day. It's unbelievable.
Yeah.
And I felt it right away. It was within a couple of weeks. I was just like, wow, this is fantastic. I feel good.
Absolutely. Yeah. Thanks for sharing, Lori. Well,
Can I jump in real quick?
Yeah, go ahead.
Yes, I just want to reiterate what you were saying. And I think one of the questions was, how long does your gut take to heal? I had several issues with my gut when I was a younger person. And everyone told me, and it ended up being about the same, if you really are true to changing up what your gut is, what you're doing, it takes about 2 to 6 months, I think, for your body to heal, like those villi in your stomach liner and all the various and sundry things, and for the inflammation to go down so that your joints don't ache and all this. I think realistically, wouldn't you suggest, Dr. Keith, it's like a good month, 2 months, even more, because it took a long time for your body to get to that position. It's going to take a few months, I would say, to get back to that spot where you're feeling pretty awesome. And then when you do, if you go off the wagon, like Dr. Keith just said, you feel it immediately, and then you can rebound almost immediately because you haven't had that constant buildup for months and months or years and years. And so give yourself, again, be present. Don't be so hard on yourself. But I would say, not that I'm a doctor, anything, it's just personal experience I'm reflecting on. I would say your body takes about 2 or 3 months to, I would say, fully heal on the inside. And then really to feel like, wow, you're going to feel great probably in 3 to 4, but then for everything else to come down. That's just my experience. Thank you.
Yeah, thanks for sharing, Maria. And you're absolutely right. It is individually based, because if somebody has never had digestion issues before and is just starting to feel a little bloated or constipated, it could take a month or 2 to get them back into balance. But if somebody's been dealing with something for a decade and they've had a raging infection down there that's been brewing for a decade, you're looking at 6 months to a year of allowing that tissue to heal. Because the one thing about the gut tissue, which is the exact same thing about the brain tissue, is that it's derived embryologically from the exact same neural cells. And the one thing that the brain and the gut do not have are pain receptors. So you don't feel leaky gut. You don't feel pain unless you have cramping or you're so bloated and distended that the pressure of the bloatingness is what's causing the pain. So that's one of the biggest things about, digestion issues, that people don't necessarily feel it because there's no pain receptors there. But yes, it does take time for it to heal. And if you've got a really bad leaky gut issue and infection and stuff, it can take a better part of a year for it to heal up. So, but the good news is that if you remove the stress and the insults of what's going into your body, just like I think it was Lori was talking about dairy, we don't realize that what we put into our mouth is either going to work towards creating inflammation and chronic disease, or it's going to go towards repairing, healing, and maintaining homeostasis. It's either going to be building us up or tearing us down. And a lot of dairy, genetically modified foods, processed foods, are complete toxins to the body. There is no nutritional value to them at all anymore by the way that they're being processed. So eating a clean diet is essential for the body to heal. All right, thanks guys, that was great. All right, so let's review what we've learned so far. So we have the mindset component, which is becoming a student of yourself, understanding what makes you tick. Learn how to become 100% present from moment to moment throughout the day. If you have a vision, goal, get some clarity around that and take action towards what is it you want to create. Fall in love with the process. Surrender to it again and again, and come from that place of strength and confidence. And we're talking about gut health. We're talking about being able to manage the stress. This is the one thing I want you guys to understand, and this is what I've become an expert in, is that mechanical, emotional, and nutritional stress. The reason why people get stuck is because they haven't identified where that major source of stress is. They haven't learned how to manage it better or eliminate it as much as possible. So you can do all the right things to help support your body, but if you don't identify and work on that stress, you're only going to get marginal results. Clean up the diet, strengthen your digestion system, decrease inflammation in the body, and if you support your adrenal function and the microbiome, your body will heal itself. Because remember, the mindset controls the gut controls the mindset. They're intertwined together and they talk to each other. And how does your body handle stress? It requires more nutrition, which creates muscle contraction when you have a nutritional deficit, which then can cause subluxations in your spine. So a lot of times the chiropractic component of this is essential for the body to heal, because proper spinal function can help balance out a key component of the body, the autonomic nervous system, which regulates many aspects of health, from blood pressure to heartbeat, breathing, digestive function, as well as controlling stress levels. Simply by getting a chiropractic adjustment, it helps to balance out the autonomic nervous system, and research shows that it actually decreases your catecholamines, which are your stress hormones in the body. Many internal disorders are resolved by spinal adjustments alone. Leaving the adjustment out of the treatment plan invites failure. So, what can we do to kind of get you going in the right direction? We have mechanical, emotional, and nutritional stress. So with mechanical stress, chiropractic adjustments to help with the subluxations. We can talk about posture, do rehab with you, giving you specific stretches and exercises to help with your posture. Emotionally, exercise. Getting out and doing a 20 or 30-minute brisk walk is enough, right? Exercise is the most underutilized form of anti-anxiety or anti-depression medication. People simply do not move enough. Meditate, journal, talking things out. I'll give you a quick story. I had a patient come in about talking things out, and she's getting adjusted regularly. We're working with her diet and her enzymes. She's taking the right enzymes for her body. And she comes in one day with a sore throat. And I'm like, well, I know that your spine is in a line and your body is nutritionally balanced. So what's left? The emotional component. So I look at her and I'm like, well, what is the throat? The throat is your voice. So I look at her and I say, well, who are you supposed to be saying something to that you're not? Without hesitation, she's like, my boss. I'm like, okay, this is what I want you to do. I want you to go home, and I want you to picture that your boss is right there in front of you. And I want you to give voice and speak out loud exactly everything that you need to say to them. So she went home and did that, and next time she came in, I was like, so how'd it go? You know, it was amazing. After I got done speaking, my sore throat went away immediately. I'm like, that's awesome. So everything is connected. And we have to take the mechanical, the emotional, and the nutritional perspective of everything that we're doing for the body to heal. Learning how to let things go, okay? All part of the emotional component. Nurture your inner child. What brings you joy? Is sitting down and putting a puzzle together, or curling up on the couch with a book, playing a musical instrument, watching a movie, taking the dog for a walk, getting out and gardening? What brings you joy? Do more of that, because when you nurture your inner child, you're putting energy back into your body, and that's what it is needed. Because let's face it, sometimes the stress of life just wears us down. Nutritionally, you want to eat a clean diet, chew your food thoroughly, eat more portion-sized meals, and take the right enzyme supplements for your body. So, being healthy and having a robust function, there is a huge gap between that and not having symptoms or having decreased function. So my question to you is that, do you want to be healthy or just not sick? Having great health isn't an accident, and it's not luck. It is about habits of health practiced daily. Creating disease is just as hard as creating health. So you get to choose your hard. So kind of summarizing everything and bring this to a close is that what I want you guys to understand is that you are not your mind. The quickest way to take your power back is through self-care. Understanding yourself, supporting normal function, and trusting that your body knows exactly what to do. We just got to stop abusing it, and we got to start supporting it. And we can see changes relatively quickly. That's the best part about my job, because homeostasis is always on the job. Innate intelligence always knows what to do. We just got to give the body the right support in order for it to heal. And then we got to give it the time and space in order for it to do that. So now you have two choices regarding your health. You can do the same thing you're currently doing, get the same results, or you can try something new, do something different, and get a different result. So I threw a lot at you guys today. And your homework assignment is to simply do this, is I want you to take 5 or 7 things that you learned today that you would like to implement in your life, or whatever the list is. And then I want you to pick one, only one. And for the next 3 to 4 weeks, I want you to master that skill. And then once you've mastered that skill and created that habit, then go on to something else. When we try to do 5 or 6 things at once, we get overwhelmed and we're setting ourselves up for failure. So just focus on one thing at a time, because I am a huge fan of baby steps. And if you guys need help, I'm going to give you, each and every one of you here, a gift. And this gift is an opportunity to come in and simply get checked. I'm going to check your posture, I'll check your spine, I'll check your digestion system and your adrenals, and I'm going to do this all at my expense. And the reason why I'm going to do this at my expense is because I don't want anything to get in the way to see if I can help you. So if you're interested in getting checked, please give my office a call and we can schedule your screening. So this is the beginning. Thank you guys, and I'll open the floor to any questions.
I have a question.
Sure.
Is it your services, are they covered by insurance? And if so, what insurance do you accept?
I am in with Blue Cross Blue Shield. That is the only insurance I'm in.
So Dr. Keith, your closing comment about, baby steps and do one thing at a time, makes a lot of sense, because you're right. If I tried to do all of it, I probably wouldn't do any of it. Or maybe I would for a day or two.
Yeah,
right?
exactly.
Yeah.
Nothing that's sustainable. Exactly.
Yeah. So, other than, that it's me, am I better off stopping eating the box of Oreos and trying carrots, or am I better off going for a walk first and then thinking about the Oreos somewhere down the road?
So my advice, that's a great question. Whatever is the easiest for you to implement. If it is easier for you to go out and go for a walk, then do that and create that habit. But do that, 5-6 days a week, right? Then once you have that in and it's part of your routine, then move on to the Oreos and the carrots. Right? If it's easier for you to change your diet, then I would start there. So it's a personal choice.
I stopped eating Oreos.
Poor John.
Yeah, I do.
Me too.
I do love me some Oreos. So.
Yes.
Yeah.
We were all talking about eating certain things, and when you remove it from your diet and you come back and revisit it, because I cut out meat as well, it's so striking. If I were to go, which I did this a few weeks ago, I went to Portillo's and had a burger. I thought I was going to vomit. It was unbelievable. I was just like, why did I do this? It was so good, but why did I do this? It's unreal how your body changes.
Yeah. Well, it comes back to awareness too, right? Somebody who's never been adjusted before, they don't know how good they can actually feel because they've got nothing to compare it to. I had this one guy come in, he's a 36-year-old veteran that's never been adjusted before, terrible neck and back pain. He's now a cop down in Chicago. And after his very first adjustment, he comes back and I'm like, this is my favorite question to ask people who are virgins to chiropractors. It's like, well, what did you notice different? The first thing out of his mouth was, I'm a lot less angry. Like chiropractic care for anger management, because you're not so irritable and tight and stressed out, so and that it kind of comes back to that awareness too. So like when you're getting regular chiropractic care, you're so aware of your spine. Well, when you start working on your diet and shift that awareness to your digestion system, and you're focusing on your food and what makes you feel good and what makes you not, like most people have no idea how they feel 60 minutes after they eat. That is the most telling sign of what you're doing to your body. Because if you are light and energetic and full of energy, then you had a good meal, you were able to digest it. But if you're heavy and you feel you're ready to take a nap or pass out, then you have digestion issues or you made poor food choices. So it just comes back to that awareness. Any other questions?
You mentioned fermented foods. What are some examples of some good fermented foods?
You know, like sauerkraut, natto, tempeh, miso. There's all kinds of like fermented foods that you can buy and look up and even make them. So.
And you also mentioned enzymes. So really you should be looking at, and I'm so sorry, I have 3 dogs and they're crazy.
Yeah,
you should be getting enzymes that fit your particular body type, right? How do you come up with that?
So that's a great question. So what we need to digest is protein, fat, and carbohydrates. Those are the macronutrients. And there are different stress points on your body that let me know whether or not what you need. So some people may need, and I have different enzymes and supplements for each one of those. So if you need more of something to help you to digest fat, then I'm going to give you a supplement that is formulated more towards fat digestion. If it's more protein or more carbohydrate, there's different formulas that you need, but your body will tell me exactly where your body is struggling from the digestion perspective. So, great question.
And you know what, I just want to add, may I?
Yes, go ahead.
You know, you asked about the fermented foods. The new thing now is to add like sauerkraut to your burger, like if you're going to eat a burger. I didn't believe it, and I'm not a sauerkraut fan. And I had this great burger, and I put that on there, and I think it helped with digestion. I really do, because usually when the burger, it's like it sits there for 3 days, you know, and I really feel like the sauerkraut helped. So I think that helps in many ways, you know, just speaking the truth to how it, you know, what you're saying.
Sure, thank you. Yeah.
I know we've had to have a few people drop off because of the timeline, and if you do, that's okay. Are there any other questions for Dr. Keith?
Very good.
Yeah. So I hope this was helpful for you guys. Thank you guys for your attention.
Thank
Thank you, Doctor.
Great presentation, really helpful.
Excellent.
All righty.
Thank you so much.